Nappy rash is a common inflammation of the buttocks, genitals and groin area of a baby, and it affects most babies at some point between the ages of 6 to 12 months. It can range from a mild irritation to a painful infection. A baby's skin is very delicate and sensitive, and it spends most of the day and night in regular contact with urine and fecal matter, and therefore it's not surprising that a baby can develop nappy rash. It usually starts as a slight reddening, and if it's treated early, generally it can be controlled. There are many causes of nappy rash, the main one being prolonged contact with urine and faeces in a closed environment as in the nappy. Also harsh detergents, soaps, bubble baths, rubbing or chafing can also cause it. So if the nappy is too tight or there are irritable plastic pants on. If the baby has diarrhea or other illnesses, that can obviously break down the skin barrier. And if the child has very sensitive skin, or maybe where there's a family history of eczema. Babies are more susceptible at certain times, especially when they're teething after their vaccinations. If they were born premature, their skin is obviously compromised a little bit. When they change from breast to bottle feeding, when they start on solid food, and if they've been on antibiotic treatment for any reason, and of course when they start on cow's milk first. The best way to deal with nappy rash is to try and prevent it. And generally speaking, if treated early, it can be controlled. The aim of prevention is to support and reinforce the skin barrier. And of course, good skin care at nappy changing is essential. Here are my tips for preventing nappy rash. Change wet or soiled nappies as soon as possible. Young babies need their nappy changed 10 to 12 times a day, whilst older babies 6 to 8 times a day. Do make sure to clean the whole nappy area thoroughly. So for little girls, that means cleaning from front to back. For little boys, you must make sure to clean around all the skin folds of the scrotum. Leave the nappy off for short periods of time because that allows air to get at the skin and is helpful. Use a barrier ointment that would aid the skin to recover, and use one that doesn't contain colorants, antiseptics, perfumes or preservatives. It's a good idea to avoid the nappy being too tight, tight clothing and plastic pants. My tips for treating nappy rash is to always wash and dry your own hands thoroughly before and after nappy changing. And always clean the nappy area with warm water and cotton wool and gently pat dry. Keeping the baby warm, leave the nappy off for short periods during the day. Apply a thin layer of ointment, such as bepanthen, at every nappy change to treat the irritated skin, aiding recovery whilst keeping it moisturised. If the baby's nappy rash doesn't improve after a few days, I would always suggest you seek medical advice.